Ellen's going to talk about priorities for addressing pressures in primary care to support the elective recovery backlog. And Ellen is GP Vice Chair of Doctors Association UK and Vice Chair North Cumbria Local Medical Committee. Thank you, Ellen.
Hello there, thanks for the nice introduction. Yes, can I just see the slides there if that's all right? So I'm going to talk about a completely different, just to give a quick background, I'm a GP up in Cumbria. I'm here today in my capacity as the Vice Chair for the Doctors Association UK, and I've also written a book, and that's what I want to talk about today, just focus on some of the pressures in general practice and how helping those pressures can relieve the pressure on the greater system. I think it's safe to say a fully resourced and funded primary care can have impacts on the rest of the NHS, and I think we need to look at GPs as part of the solution and not the problem. So next slide, please. Well, I'm actually going to gloss over these figures because I think they've been dealt with, and what I would like to focus on is some of the figures within primary care. So can we just go to the next slide, please? And in a nutshell, what is going on in general practice? Essentially, we're seeing reducing numbers of GPs. Wait for the next one. We're seeing patients who have got access problems to get into primary care. Patients are becoming increasingly frail, increasingly complex. General practitioners are now dealing with complex medical problems that only a few years ago would have been dealt with in secondary care. So this is all leading to a rise in workload. Next slide, please. And I thought I'd start by looking at some of the facts and figures about what is going on in general practice. So this is quite a nice graph from the King's Fund. And it surprised me really just to think about what's going on in the NHS every single day. So this is a snapshot of NHS activity. And it shows that every day within the NHS, GPs have 1.3 million patient contacts. And I did think that was interesting because in the news, we hear about the 7 million on waiting lists. We hear about the queues of ambulances, but the problems within general practice are often glossed over. But I think this could be key, just addressing some of the pressures and the problems in general practice can have a knock-on effect to the rest of the health system. So if we just compare it to the little blue box, little blue circle in the middle, and we can see that in A&E, there's 67,000 patient contacts every day. So for every 20-30 patients a GP sees, only one of those is getting seen in A&E. Next slide, please. And what's also surprising to me is funding that general practice gets. So we get less than 5.6% of the total NHS budget. Again, if you look at that little turquoise box in the middle, primary care gets 14.6 billion. But we need to remember that primary care is not just general practice, it's also dentistry, optometry, community pharmacy. So what general practice gets is actually about 10 billion of the overall pot. Next slide, please. And it's safe to say that as workload for GP practices has increased, if you look at the graph on the right from the BMA, pre-pandemic GPs were seeing about 25 million patients per month, and this has risen to over 30 million now. So workloads increased by 20%, but funding has decreased by 20%. So general practice back in 2016-17 was getting about £153 per patient per year. In 2022, it's 164, but if we account for inflation, in real terms, £153 is worth about £200 in today's money. So we've actually had a 20% cut to our funding. And this is one of the main reasons why GP practices are struggling to employ GPs at the moment. Next slide, please. It's also interesting to note that some of the money that is given to general practice has been put into other initiatives by NHS England. So these initiatives were all put in place to try to improve access and to reduce the number of GP appointments needed, but they are all in fact more expensive than just funding core general practice. So if we look at things like acute care hubs and pharmacy first, all of which were brought in to improve access, they cost about £48 per appointment. We've now got about 30,000 ARRS staff, so that's the additional role staff, so staff such as physicians associates, pharmacists, social prescribers. All of these staff were brought in again to try and reduce the need for GP appointments. but again, they're more expensive than an actual GP appointment at about £35. Again, urgent treatment centres, £85, and it's not on the slide, but a visit to A&E, I believe, costs around £300. So going back to general practice, if we are getting £164 per patient per year, the average person sees their GP about 7 times a year, which works out at about £23 per appointment. So we just need to try and fund core general practice itself. Next slide, please. So despite no money and more work, we've also got less hands on deck. So we've now got 2,000 fewer GPs than we had in 2015. The ratio of GPs to patients is now about 1 GP per 2,300 patients. And the safe limit recognised is a ratio of about 1 GP to 1,800 people. So despite GPs leaving, we are seeing the number of patients registering at practices continuing to rise. So essentially, there needs to be a real focus on putting the money into general practice to fund GPs to maintain safe levels to look after patients. Next slide, please. And again, the problem is not training GPs. Successive governments have promised to recruit more GPs, and we've done that. But the problem is we are losing them at the other end. So this graph from the Institute of Government has shown that it's worryingly, it's younger GPs who are leaving, and 1 in 4 younger GPs are leaving. So next slide, please. So what I'm going to talk about very quickly is some solutions and what we can do to improve primary care, to have a knock-on effect and impact the rest of the NHS, and ultimately improve all these waiting lists. So number 1 is financial investment. And we know the recent Darcy report highlighted a shortfall of 37 billion investment into the NHS under the last government. 37 billion could rebuild every single GP practice in the country. And we've heard about the fact we've got less funding. There is a huge inequity between primary and secondary care resourcing, and funding for hospitals has grown while it's gone the other way in general practice. If we were to invest just £35 per person per year, this would restore GP funding to the 2015 levels and enable us to recruit staff and address some of these huge workloads. The Darcy report did also mention that GPs have the best financial discipline. We can't run up large deficits and be bailed out in the same way hospitals can. And I just put this tweet in there from Steve Taylor, who provided the statistics I'm using today. And just to highlight really that £35 is, we don't really think of it in day-to-day life. So a takeaway coffee a week for a year is £800, and it's very small amounts, and we need to think about investing in our primary care services too. Next slide, please. So number 2 is workforce investment. And I'm not sure if you're aware, because it's not really hit the mainstream media, but we have this strange paradox where we're desperate for GPs, but we've got GPs out of work. And again, this year we've had stories in the media that GPs have been working as Uber drivers, they've been working in Tesco's because they cannot get work as GPs, and this is essentially a funding issue. Practices cannot afford to employ GPs. There is a pot of money which has been sidelined for ARRS staff, so GPs have got money they can, so GP practices can spend money on these allied staff, but not on actual GPs themselves. So GPs are more expensive, but more efficient and a better investment in the long term. And we need to encourage GPs into roles and encourage them to stay rooted in their communities, because it's been shown that continuity of care does save lives, better for patients, better for GPs. It just makes sense. And we need to invest in meaningful careers. So GPs with extended roles, it used to be called GPs with specialist interests. It's something which GPs can specialise in different areas of practice, and this alone can keep waiting lists down, in the fact that a GP with a specialist interest in ENT or gynae could undertake some of the less complex procedures, deal with them, and then it's reducing the waiting list for secondary care as well. Next slide, please. And I'm just going to touch on this one to talk about the collective action that GPs are doing at the minute. And every single day within general practice, GPs are asked to perform additional work by hospital teams for free. So work that we're just not funded to do. But historically, the NHS has been propped up on a lot of goodwill, and GPs have just done it for the best interests of their patient. But it's becoming apparent now that it's not in the best interests of patients, because all the work that we do without funding for other people is work that we're not doing for ourselves. We're not seeing patients. So things like ordering and chasing blood results, imaging, providing fit notes, initiating medications, referring to other specialties. The LMCs have done some work, and it's shown that this transfer of work from secondary to primary care is equivalent to the work of over 1,000 full-time GPs. So addressing this alone, it could potentially free up 3 million GP appointments. So that's appointments where we could be seeing the people who are on waiting lists. We could maybe sort their problems out. It's a huge amount of workload. So this is within our power to do something about it, and focusing on the primary and secondary care interface can really smooth over some of these problems. Many hospitals have GP liaison teams who can help do this, and it would be great to set them up throughout the country. And they can help different specialties have their own standard operating procedures to incorporate this workload so it isn't defaulted to the GP. And at the top there, I missed it, but one of the biggest things that could be done to help with prescriptions is to set up electronic prescribing in hospitals, direct to pharmacies, and then patients aren't going between primary and secondary care, running around for prescriptions. It's just the person who wants the medication can prescribe it. Next slide, please. And because this is the Westminster Forum, one of the solutions which could help in the longer term is to create a cross-party NHS, so that every time there's a new government, we're not having recurrent reforms. So we've just had the Darcy review, Labour are doing another NHS review, and the information's already there. If we had a cross-party group and some stability, the same people could focus on the problems and remove the NHS from short-term decision making, and basically make long-term investments for the good of the NHS. And next slide, please. And that's me done. I just wanted to leave a little note to say, well, the Doctors Association, we're a group of voluntary doctors who advocate for doctors and for the NHS, and we're always happy to hear from you, talk to you about general practice. And yeah, I'm not going to have time, I'm afraid, to stay for questions because I'm in clinic. So I'm happy to have any questions emailed to me.